We begin with the rise in COVID-19 cases locally. The Texas Medical Center reporting its positivity rate is at 11%. That's compared to 2.4% just a month ago.
Also, 1 month ago, there were 132 new cases a day. Yesterday, however, that was up to nearly 1,500.
And with the Delta variant driving this fourth wave of the pandemic, those who are vaccinated worry about these breakthrough cases.
But the big question for a lot of people, how often are they occurring and how severe are the symptoms? Our Maria Salazar live after speaking with an infectious disease expert about this. Maria.
Hi, Jonathan and Rashi. Well, the first big point he wants to get across is that breakthrough cases are to be expected as these vaccines and no vaccine is 100% effective. However, he emphasized that this rapid increase that we're seeing in cases and hospitalizations is not due to these breakthrough cases.
There are two things that I want for people to know.
Infectious disease expert Dr. Pedro Piedra says first, the current rise in COVID-19 cases and hospitalizations is because of those who are unvaccinated. And second, breakthrough cases happen for several reasons.
One can be because the virus has changed sufficiently.
Another, he adds, is the more people get vaccinated, the more breakthrough cases there will be.
When they occur, most of the individuals are asymptomatic or mildly symptomatic.
As of mid-July, the Centers for Disease Control and Prevention report of the more than 160 million who have been vaccinated, there were 5,600 breakthrough hospitalizations and just over 1,100 breakthrough deaths. From January to April, the CDC tracked breakthrough cases, hospitalizations, and deaths. Since May, however, they focused on hospitalizations and deaths. Some public health experts believe this makes it challenging to assess the impact of the Delta variant on breakthrough infections.
What we report, so when we do a test, what we report is the information that is being requested by the Centers for Disease Control and by the Texas Department of State Health. And at least vaccination status has not been a mandate.
As for breakthrough infection rates among the pediatric population, Dr. Piedra says that remains unclear since vaccinations for 12 and up only began in May, but he believes they are occurring.
Nobody is going to be immune to breakthrough infections. They will occur. And so as you vaccinate a larger segment of the pediatric population, you would expect to see some breakthrough infections.
And now another big question and concern for parents is how is this Delta variant impacting hospitalizations among children, especially those who are under 12 who are still not eligible to be vaccinated? Well, I spoke to the interim pediatrician in chief at Texas Children's Hospital. He says that they've seen an increase, especially in the last 2 weeks. I'll have his full interview on the News Edge Early Edition at 6. Maria Salazar, Fox 26 News.